请问一下，在场是兽医师的请举手。
Well, thank you for coming.
谢谢大家。
So we'll talk a bit about some surgical techniques and procedures as we go through this. So this is something dog population management, like this is not a course or a topic that's taught in veterinary school, right? Like in veterinary school, we're taught surgery, we're taught medicine, we're taught anesthesia, but this really is a unique field in and of itself as to how to really provide top quality care with oftentimes very limited resources and in very challenging environments as well.
And so while there are some similarities in terms of the care that we provide in traditional veterinary practices, there's also some very unique challenges when we talk about dealing with free roaming dogs or working in shelters, doing high volume spay-neuter programs. And so in a traditional veterinary clinic, the patients that we see are normally owned animals. They might have received preventative health care in the past. They might be vaccinated. And they have owners, right? They have owners that can provide for their needs. Whereas when we're working in the field and we're working in dog population management, often the animals have no owners, or they might be loosely owned by people in the community. They may or may not have ever been to a veterinarian before. They probably have never been vaccinated before. And there's just very limited resources which to devote to them. So our job as veterinarians is to take all of the gold standard principles that we learned in veterinary school and to try to apply them in situations where we can help the most animals, oftentimes, have good outcomes in the face of often limited resources. And we have some guiding documents to help us, to help guide the medical and surgical practices that we use, particularly for dog population management, but also for sheltering as well. And this is really a landmark document, this Guidelines for Standards of Care in Animal Shelters, because before this document was published, there was very little for shelters to use to know what is appropriate and what is simply unacceptable in shelters. The same organization that published this document, which is the Association of Shelter Veterinarians, they've also published another guidance document that is focused on providing high volume, high quality spay-neuter practices. So a lot of what I wanted to talk about in this presentation is surgery, because that is often the veterinarian's role in dog population management. It's not to say that veterinarians can't be the managers of these programs, and oftentimes they are well suited because they have the medical knowledge. Veterinarians are not often the best managers though. But so they're oftentimes the one that they're delivering surgical services, or they're treating the animals. Or maybe they're also helping to treat shelter animals as well. So they might be working in shelters. So when I was thinking about, what to include in this presentation, because there's so much, like all of these topics could be entire presentations in and of themselves, and even entire courses. What I thought would help would be to just give an introduction into what we call high volume, high quality spay-neuter. There is also a lot of debate about what is high volume. And so how many surgeries we expect a surgeon to do, and a lot of times that's dependent on, the support staff, right? A veterinarian can't do a lot of surgeries if there's not trained nurses and technicians to do that. When I think of what high volume is to me, I had mentioned in the last presentation that our veterinarians, we expect them to do 20 to 25 surgeries a day. In North America, I would say that number goes up to around 40 a day. But that also might include cats, so a combination of cats and dogs. But typically speaking, in high volume surgical environments, again, the veterinarian is just doing surgery. They are standing at a table doing surgery. They're not walking off to write medical records. They're not going to see clients. They're not going to go vaccinate dogs in another room. They are standing at a surgical table doing surgery. I mentioned this already, but this document, so this is found on the Association of Shelter Veterinarians website, and so it's readily available for download. And it provides guidelines for high volume, high quality spay-neuter. So how should we be sterilizing our instruments? Should we be giving antibiotics? What are surgical techniques that are accepted practice? And so there's a lot of valuable information, and it's broken down into 3 sections. So it is medical guidelines, surgery and anesthesia, and then also how do we identify animals that have had surgery. Do we tattoo them? Do we microchip them? What does that look like? I mentioned this in the last talk as well, but just a point that I want to keep driving home is that these guidelines can really be applied to all settings. I know we think as veterinarians that, okay, surgery that takes place in a traditional operating room, right? That's in a hospital, you have hospital lights, you have anesthetic machines, monitoring machines, but we can indeed provide really great outcomes for our patients, even in settings that are certainly less resource. And so we shouldn't let perfection be the enemy of doing good, right? We can still achieve good outcomes even if, we're not in a traditional hospital setting. I wanted to talk about, so we're going to transition out of Asia for a minute, and we're going to talk about Puerto Rico. And Puerto Rico, is an island south of the U.S., and it's actually owned by the U.S., but you wouldn't know it was owned by the U.S. by going there. There is very high levels of poverty. So a lot of free roaming animals there as well. A lot of animals even owned animals are allowed to go outside. So they, contribute to the dog population in Puerto Rico. And Hurricane Maria hit the island in 2018. And it had devastating effects. So the poverty was already very high. And then what you had was people trying to flee the island because of this, severe hurricane. And you had massive, kind of dumping of animals left behind. And so a situation that was already bad just became, 10 times worse. So when we say MASH, we mean field clinic. So we say here, okay, the most ambitious and creative field spay-neuter clinic ever envisioned. And so, this is another situation where we felt that there was an opportunity to bring high volume spay-neuter services, particularly to pet owners, because there was an estimated, actually nobody knows, well over 1 million pets that are unsterilized that are contributing, again, because of this culture in Puerto Rico of animals also being allowed to go outside. There was, rampant overpopulation and births of unwanted litters of puppies. So we started to think about, well, how can we do this again, similar to the Bangkok situation? Like, how do we think about delivering services when the veterinary capacity in Puerto Rico was very limited? There were certainly a lot of clinics, and a lot of veterinarians actually trained in the US that opened up small clinics, but they certainly weren't trained in high volume, high quality spay-neuter, and they weren't in a position really to do this on a larger scale. And so we started to think about how we would do this, and we had the idea just to bring in 5 to 6 teams from the US and Canada that were trained in high volume surgery, or maybe came from a veterinary university. So Cornell, for instance, Cornell University sent a team as well. And so we would hold these 1-week clinics where we would bring these teams to Puerto Rico, and we would do a big MASH clinics all around the island. So this is just one clinic, and it would operate for 1 week. It would do between 400 to 600 surgeries a day, ideally. And so you can see this is actually a basketball arena. So we were actually able to get a lot of government support for this initiative where they would allow us these big kind of arenas and convention centers to set up. So we would bring these teams every 4 months to do these major 1-week clinics. And we would team them up with the local NGO. So each one of these clinic sites, it would have a surgical team that would come in. It would have a local NGO that would help provide logistical support. There would be local government as well involved in the clinics to do advertising and security. And we didn't know how it would go. Like, we didn't know if people would even show up, what the outcome would be, how would we standardize the medical and surgical practices of all these teams. And so there was a lot of planning involved. We knew also that we wanted to involve the veterinary community in Puerto Rico. And so they actually formed their own surgical team that we helped train for these rounds. And all of the equipment that we would purchase, and this is hundreds of thousands of dollars of equipment, would be donated at the end of these clinics to the veterinarians in Puerto Rico so they could continue this work after this program ends. But one of the important things, and the reason I wanted to talk about this program, is because this is such an amazing opportunity for data collection and for publishing data on these types of clinics, because we have very scarce, like not a lot of spay-neuter morbidity mortality data when we look in the literature, and particularly involving high volume, high quality spay-neuter. So every owner that brought their pet in, 50,000, they fill out a questionnaire. So we can see, did the pet ever have a litter? Has it ever been to a veterinarian before? And then we could also track all of the surgical outcomes, complications, cryptorchid, any other medical conditions. And then that will allow us to publish that data to really provide us with an actual baseline assessment of how safe these types of programs are. So I'm going to just show a quick video showing the program.
This is Camila. She's 3 years old. She likes to play a lot, and she likes to sleep a lot too. She snores at night. She took time to wake up, but she's just all ready to go home and have fun.
Headed over to Vieques, but it looks like it's raining pretty hard, so we may end up trying to make our way to your field.
After Hurricane Maria, this was a chaos. The economy here is terrible. People had to go to the States to find jobs.
It was really difficult for people to fly their animals out if they had to evacuate. A lot of them didn't have choices. I've seen people that have gone without food themselves, that put their animals first. I was shocked by the absolute love that they show for animals.
It was devastating seeing so many dogs and cats without food, without shelter. It's like a kid. For me, a dog is a kid. And when you see so many dogs out there that they don't have any families, so I'm sorry.
It offers free vaccines, sterilization, dog food, collars, leashes, all of those good things to really help the local pet owner take care of their animal better. Everybody knows that after an animal gets sterilized, it leads a healthier life. So we want the owners that just went through Hurricane Maria to have their pets for as long as they possibly can. There's a large part of the population in Puerto Rico that is under the poverty line. So there's not necessarily the financial ability for them to have this happen for their animals otherwise.
I love this thing that is being done here for the dogs and cats in Puerto Rico. I couldn't afford it. And everybody here is happy because they have the chance. They don't have to pay for it.
People that I've spoken to have said that this is an effort that they've been waiting their entire life for.
They are our family, our children.
I love animals. They're like my whole life.
This is a family. This is not a pet. This is my wonderful boy.
For 23 organizations to come together, that has never happened in any part of the world. The governor and the First Lady of Puerto Rico are really the impetus behind this effort, and it's really part of their legacy.
Our society can only be evaluated as well as we treat animals.
I hope that this is an example for every part of the United States and the world also to emulate.
I am confident that will benefit our society greatly.
So our goal is to sterilize at least 20,000, if not 25,000 or more animals in the next year. That means less animals going into the shelters and less animals entering into the street population. At the end of the initiative, we leave behind all of the equipment and resources so the local veterinary community can replicate this work. This has absolutely been the hardest work of my entire life, but it's also the most rewarding, especially after Hurricane Maria and seeing what they went through. I'm really proud of this work.
I know everybody's working so hard. I want to thank you guys because this has been a great experience here. She got the shot, she got a pill for the fleas and ticks. I mean, what more can you get?
Okay, so that video was made actually after only the first round. So the program has now sterilized over 35,000 animals after only 3 rounds. You can see where the clinics are held throughout all of the island to provide equal access to people that need, surgical services for their animals. You can see also here how the clinics are set up. We have all of these surgical tables here, prep tables, and this is the owner waiting room. So I mentioned data collection, so we have now over 500,000 data points from all of these animals. Veterinarians saying, that they don't like these programs. They don't like these programs because it takes business away from them. Like, well, you're taking income away. But the reality is, so when we ask owners, has this animal ever been to a veterinarian? 44% have never seen a veterinarian before. 30% of females had already had an unwanted litter before. And so it really shows that actually these are not the clients that are usually coming to the clinic because they've never been. But furthermore, that this is now an opportunity it's really a gateway to a start of a lifetime of veterinary care, because now the owners have had the animal sterilized. They now understand, they've been educated on getting repeat vaccines and medical care. And so it's really an exposure for so many people, to veterinary care for the very first time. So obviously safety is our utmost importance, right? We want pet owners satisfied. We want our patients to be taken care of. So all of these animals are having a very detailed but a physical examination. So these animals are not getting blood work, right? So these animals are getting a comprehensive physical exam. They're having their heart and lungs listened to make sure there's no issues there. And so when we look at, the initial data, we can see how many animals were cleared for surgery, and 352 patients were sent home for whatever reason. They were not surgical candidates. And we also track, when there's a surgical complication, but also to the benefit of the patient. So what were we able to treat in these clinics? And so we found out of this initial, 25,000 cases that 123 cases of pyometra, so infection of the uterus, were treated, and also 401 cryptorchid, testicles were removed as well. And when we look at surgical outcomes, so when we look at the number of patients that had challenges or morbidity, mortality that happened during the clinic, again, these are pet animals, right? So the majority of them, they have owners that are waiting for them. So not a true street dog DPM program in that manner. But what we found was 99.7% of animals undergoing anesthesia were cleared to go home to their owners on the same day. And all of these clinics have a nearby veterinary practice or a nearby clinic that is on call for emergencies or that is willing to see any postoperative complications after the animal goes home. And so what we saw is from the clinic, 40 animals, again, out of 20,000+, were transferred to veterinary clinics following surgery because of some intraoperative complication. This is looking at the availability of published papers. So when we look in the veterinary literature, what is the mortality rate for spay-neuter surgery? And again, it's pretty sparse. But we do have some programs that look at TNR programs for cats, in animal shelters, some high-volume spay-neuter clinics. And what we're finding is that the Spay-a-thon is really similar to the mortality rate that we've found in a published study in UK veterinary clinics. So the mortality rate is extremely low. It's about 0.1001. We often use, the mortality rate of 0.003, and so in fact, for general veterinary spay-neuter surgery, and so in fact, the spay-a-thon clinics are actually outperforming many veterinary clinics in terms of complications and mortality rate. So I want to transition away now from Puerto Rico and just talk about surgical practices in general. So how do we minimize complications, maximize safety, and make sure that we're doing surgery as aseptically and as effectively as possible? So as a general rule, surgical caps and masks should be worn by the surgeon, generally speaking. A surgical drape is required for all abdominal procedures and for male castrations of dogs. The disinfection and the surgical preparation of the surgical site is super important. It has to be with an appropriate scrub and solution, like a chlorhexidine or similar. And really, we should not be sharing surgical instruments between patients. Each patient, new set of instruments. Even for litters of puppies, kittens, we should have enough instruments for each patient to have clean, sterile instruments. So a lot of debate as well about how we sterilize our instruments, particularly when we don't have enough, because instruments are expensive, at the end of the day. And so it's hard to have enough instruments. We do know, though, that these are less ideal. We see field clinics using cold sterile. So, we have cold sterile and then we have autoclaves. Autoclaves, we purchased these for spay-a-thon for Puerto Rico, and they're very expensive. They're very expensive, especially when they have to be shipped on a plane to the island. And so there are alternatives to autoclaves like pressure cookers, like hot ovens. Those need to be used in a certain way. But when we can use steam sterilization, that is best. There are ways of using cold sterile solution, is what we call this. But the problem is usually the contact time is so long that these instruments have to sit in this, this solution, that if you're doing many surgeries, it becomes impossible to keep this sterile and to ensure the contact time that's necessary. So for the Bangkok clinic that we talked about earlier, we have big pressure cookers that we hook up. And so that essentially uses steam sterilization. It's like a poor man's autoclave. And so we have somebody cleaning and autoclaving instruments throughout the clinic. There's a lot of debate about the routine use of antibiotics for healthy patients that are undergoing spay-neuter surgery. And if we look at what the guidelines say, the guidelines are very clear that the routine use of antibiotics is not appropriate for a healthy patient unless there is an obvious break in sterility or there's some type of infection or pre-existing condition. But generally speaking, our healthy spay-neuter patients shouldn't be needing antibiotics at the time of surgery. So a lot of different anesthetic protocols. Some use gas anesthesia, some are simply injectable. Regardless, we always want to avoid mask induction. We never want to just gas down a patient. If we do have gas anesthesia, that's not appropriate. If we have intubation available, particularly for dogs, for maintaining an airway, that's great to do. There's some interesting research in cats that actually shows that if you're intubating a female cat, they're actually at increased risk for morbidity, mortality, if it's a healthy, short procedure. So we don't intubate cats as a general rule. If they need gas anesthesia, we can mask them during the procedure. And regardless of whatever anesthetic protocol that we're using, we have to make sure that the patients are getting adequate pain control. So that's usually, as part of the, the anesthetic protocol, and potentially also as a take-home medication as well. At these clinics as well, every patient has a medical record. That's also a minimum requirement, that we are recording drug doses, we're recording times, and any anesthetic complications. So you can see this is actually from Puerto Rico. So we can see there's, a medical record there that accompanies the patient. And in this clinic, they're actually using a pulse oximeter to monitor heart rate. But that's also because the clinic has the money, has the budget to do these things, right? So we'll compare it again with a more realistic situation for many of us working in the field. And the best anesthetic monitoring tool that we have is somebody hands on the patient, making sure the patient is breathing, checking heart rate. If we're going to have anesthetic complications, it's typically going to be at the time of induction or during recovery. Anesthesia is kind of like a plane. When you hear about planes having accidents, it's normally during takeoff and landing, and anesthesia is very similar to that. A lot of different ways to identify animals as being sterilized. Certainly in North America, this has become very common. So this is the little green tattoo on the ventral abdomen. You can actually get this tattoo paste at like art stores as well. And so this little green line just tells us as a surgeon that if we have this patient on the table and we shave and we see this, okay, we know they're sterilized already. Okay. So a lot of methods with tipping ears, that's very kind of universally accepted for free roaming cats. We also see sometimes ear notching for dogs in certain situations, ear tagging for dogs, you'll see sometimes in Eastern Europe, and of course a microchip, which it's probably the most expensive way of identifying animals, and the most obviously you can't see a microchip, but it does help if you're in a situation where veterinarians are scanning for animals. This seems maybe really silly, but it's really important, particularly if we're working with free-roaming animals that are living outside, because we don't want them to get recaught and then have surgery again. And then as a surgeon, I'm sure you can appreciate like how difficult it is, like fishing around an abdomen looking for ovaries and uterus. So it just really saves a lot of people a lot of time to just somehow physically identify the animals being sterilized. And one of the kind of the real take-home points from high-volume, high-quality surgical clinics is that we want to be efficient with our time, and particularly for the surgeons. When we handle tissues less and we cut less and we are clamping less, it's less trauma for the patient. Yep, it's less painful, it's less trauma. And so we want to be as efficient because we don't want to waste time. The less time that the animal's under anesthesia, the better, and the more quickly we can work, the more efficient we are. It simply means we can do more surgeries, right? We can see more animals in that clinic. So we want to minimize time between patients. So again, each person in the clinic has a role. They are trained in that role. And the surgeon, again, is standing at the surgery table doing surgery. And ideally, we like to limit the time in between patients to 2 minutes. Yep. So really the surgeon should finish up. They should, if they do a tattoo, they change their gloves, they put on new gloves, and then the nurse has already put a new patient on the table, and they're already prepping it. So the surgeon waits there, stays sterile, starts the new surgery. Yep. Finishes that surgery, okay, changes gloves, goes back. Okay, they're not taking smoke breaks, they're not snacking, they're doing surgery, right? Because that's what we're paying them to do. We're paying, veterinarians are expensive. So we have to make the most time from them that we can. 2 minutes doesn't sound like a lot of time, but if you're doing 30 patients a day, that's an hour. Like that adds up to an hour of downtime that's somewhat wasted during the day. So when we're doing surgery, what are the steps that often take us more time, that are kind of I don't want to say wasting time, but that are limiting? So oftentimes it's finding the linea alba. It's knowing where to cut. Can you see it? Can you not? Where is it? That takes time. It's finding the uterus, yeah, especially for veterinarians that aren't very experienced. They're fishing around, they can't find it, it takes a long time. But when you watch, someone who does this day in, day out, they are trained, it is first time they find that uterus. Breaking the suspensory ligament, again, this is a feel thing, and it's an experience thing, and you get more confident the more times you've done it. Finding a dropped pedicle, this is always time consuming, so we try to, again, we avoid, through different techniques. Patients getting light with anesthesia, right? You start to pull on the suspensory and the dog's waking up, and then you have to wait several minutes, and then you have to turn the gas up. So really finding, an anesthetic balance and an anesthetic protocol where you don't have that happening, because it just wastes time throughout the day. And then again, waiting for patients, that takes time. So now just a few tips going forward. So one is to simplify your instrument pack. Sometimes you go to these clinics and it's like 30 instruments in a pack to sterilize a female cat. Like, we really can be efficient in our use of instruments and have them organized as soon as you start the surgery. You have your spay hook, you have your thumb forceps, your hemostats, everything's ready to go. Plan before you cut. So know where to place your incision, right? We want smaller incisions. Smaller incisions are less painful. They will heal quicker. The animal is less likely to traumatize that site. I know that we're always taught when we start to do surgery, we make these huge incisions because we want to see everything. But as we develop confidence and skill, we can minimize the incisional length. The way I think of it too is if you make a small incision, it might take you a bit longer to find, the uterus. But I can guarantee you it will take you longer to close a big old incision. So you'll save time in the closure by making that small incision. And we can plan, right? We can plan where we know the ovaries and the uterus are going to be. So, this is the umbilicus here. And so for an adult dog spay, we're going to make it, just maybe a finger length behind the umbilicus. For the cat spay, it's going to be in the middle. It'll be in the middle between the umbilicus and the pubis. And for a puppy, so for a juvenile dog, I'm going to go in the same location as I would for a cat. So I'm going to bring it halfway back. In terms of your closure, obviously closure is very important, and particularly for dogs that are going back. Like, we have to make sure that our closure is appropriate. And so, to be honest, it doesn't really matter to me continuous or interrupted so long as it's appropriately closed. What I will say is we want to minimize how tight we do that first layer. Those first 2 throws shouldn't be very tight because it's very painful. It's painful, and it can cause the animal to traumatize the site. I like cruciates, like this is a cruciate in this photo, because it's covering more area without as many knots as an interrupted. I wanted to talk very quickly about cats, because cats can be very quick, particularly if you're doing a TNR program and you have hundreds of cats, let's say, that you want to sterilize. And so I just wanted to share with you, and maybe you're already familiar with it, so just, sit there and enjoy the video. If you are already. But this is such a time saver in cats, and it's called a pedicle tie. It is where we are tying the vessel in the ovarian the ovarian pedicle on itself, so we are not using suture material. So there is a nice publication that came out a couple years ago really showing how this is indeed time saving when we're doing cat spays. So I'm going to explain it to you, and then you'll see the video. It's really quick. So in the pedicle of the cat, right, we have the vessel that we're worried about, that we want to ligate. We also have a little ligament. We can cut that ligament, the suspensory ligament, in cats. There's a little vessel, but it's not going to bleed significantly. So once we isolate that vessel, we can use an instrument to tie it on itself, forming a knot. Okay, so we're going to show a video, and it goes fast. So get ready. Okay, so a cat spay. Okay, so here this is how they're going to use a pedicle tie on both ovarian pedicles. The suspensory ligament. Instrument tie. Cut. Then there's a little knot. Tighten. Release. Okay, side 1, done. Ovary, ligament, break, tie, knot, cut, tighten, release, done. This can only be done on cats, not dogs. Yep. The pedicle is too bloody. The vessel is not as well defined in dogs, only in cats. In North America, you will see every high volume surgeon doing this in cats. So it's not just some weird practice that I made up. So. I like to share it because it saves you so much time and it makes you feel like, why was I ever using suture material on an ovarian pedicle in cats? For animals that are being returned, right, to the streets, we don't want to put skin sutures in, right, because they are not going to be brought back for suture removal. And so we always want to do an intradermal pattern with our suture line. We want to make sure also that we're controlling bleeding, right? And so we can use a mixture of lidocaine and epinephrine. And so we can keep that in a syringe and we can use that in our incision lines. We can use that for our neuters because again, we don't want a lot of bleeding or even from the subcutaneous. We want to minimize bleeding again, because oftentimes these animals are not going to come back if they're returned to their communities. I wanted to mention in many DPM programs, we'll see veterinarians doing surgery on the side. So this is a flank approach to a spay. And there are obvious benefits to this. The biggest one being that I can clearly see from a distance if that incision is infected or it's having any issues. The major downside is that if you drop a pedicle, you will not find it. Like very, very difficult. So it's something that you really have to build confidence in order to do. But obvious benefits, and particularly in cats, for those that are lactating, to do a flank spay, there's a lot of benefits to that. Especially if the dogs are not friendly and you can't handle them, you don't now have to like crawl underneath them to look at the incision or try to pick them up. You can just see from a distance. It's also about conserving resources, right? The more money that we can save and the more cost-conscious decisions, it means that we have more money to sterilize more animals, right? And so there are many things that we can do to save costs. For one is to use suture on a reel. So suture on a reel is far cheaper than using individual packs of suture, yeah? There's also other cost-saving techniques. This is actually the use of corn oil, and we can use that as a lubricant for the eyes, particularly for cats and for dogs during clinics, so that we don't have to buy special ophthalmic ointments for use during anesthesia. So then we come to the question, so we have dog population or cat population management programs, and when do we release these dogs? So we do surgery. So this is a clinic in Indonesia. So we did flank surgery, so you can see, and a little green tattoos in the ears, and they're recovering. When do we allow these animals to go back? And unfortunately, it depends. Like there is no one-size-fits-all solution to this. In a lot of cases, it depends on what your capacity is to hold all of these animals, right? If you're doing 50 to 60 surgeries a day, do you have holding capacity to keep these dogs for multiple days, right? I think one of the biggest challenges too is it depends on the surgeon's skill as well. Like if you have a surgeon that is very skilled, small incisions, very minimal complications, and the dog recovers from anesthesia, can it go home that same day? Potentially. Is it maybe better practice to keep it for a couple days to make sure that the wound is healing, to make sure that it's eating? Sure. But it depends on what your capacity is to do that. Like, do you have a cage space for that dog? Do you have a staff member to look at it? Is it potentially going to contract an infectious disease if you're not having good cleaning practices? And so in some cases, I think it is better that the animal goes back, particularly for feral cats. Like cats are stressed. They do not do well, in a trap or in a cage. And so I think that's a good example of an animal where it is better that they go back, the next day after surgery. Okay, so we're running a bit low on time. So pediatric spay neuter in 5 minutes. So in veterinary school, we're often taught, 6 months of age, that's an appropriate time for sterilization of animals. But certainly the trend is that, that recommendation is not based on much evidence whatsoever. And that in fact, there are many benefits to sterilizing before 6 months, even as early as 3 or 2 months of age. The benefits of pediatric spay-neuter are numerous. These are easier surgeries. At the end of the day, they require less staff time. They are far lower in complications. The anesthetic time is incredible. I mean, these puppies and kittens are up after surgery 10 minutes after they've just gotten off surgery, and they're up and about like nothing ever even happened. It's a far easier surgery compared to like a bleeding, obese, pit bull type dog. These are just fundamentally easier surgeries, and this practice of pediatric spay neuter is endorsed by many different veterinary organizations around the world. And if you're working on a DPM or a cat management program, and let's say you get puppies in that are 4 months old or kittens that are 3 months old, this may be the only time that these cats will ever present in their whole life. Yeah, for veterinary care, for surgery. So then you have to make a decision in that moment, what to do. And so our standard policy is that we will sterilize, usually 3 months and up. But there is, even a 2-pound rule, 2 pounds, 2 months. That's about 0.9 kilos as a minimum requirement. So these patients are prone to hypoglycemia, so no fasting for these guys. Yep. So it's not, a 12-hour fast. They can eat up to 3 hours before the surgery. We can also use a little corn syrup or Nutri-Cal on their gums using swabs before surgery as well to keep their glycogen storages up. These patients are very prone to getting cold. Yep, you show them a bottle of anesthetic drug and they start getting cold right away. So we have to make sure we keep them warm. So we avoid using any alcohol during prep. We want to warm the prep solution ideally so that that's not cold. Keep them off cold surfaces and then use heat lamps or use some way of keeping them warm in recovery. So we can use these kind of warm water circulating blankets. We can heat, this is actually a rice cooker, so we can heat the scrub solutions in there. We can use little baby socks to keep their paws warm. And this is actually used like for marathon runners, but that actually can help also keep heat in as well, so we can wrap them up in that. This is a small incision. Yep, it's a small incision. We're using single ligatures. One thing that people get very shocked by is when they open the abdomen of pediatrics, there's a lot of liquid. It looks like ascites, but that is actually normal in pediatric patients. Obviously, they have minimal blood volume, so we need to minimize blood loss, as with all of our surgeries. But these are very quick procedures, and you'll just be amazed the first couple times you do them, how simple and quick, and how much flexibility there is in the reproductive tract. So it's really easy to localize and to do your ligatures. Similar anesthetic protocols that you use for adult animals can be used in puppies and kittens as well, with the exception of barbiturates that they do not have the hepatic ability to metabolize yet. We really like to use dexmedetomidine in these little guys as well because we can reverse it with atipamezole right after the procedure. I am going to go through this because we are out of time. What I do just want to mention very quickly is that we do have to we have to recognize that there are these diseases that animals can be incubating, right, when they come to our clinics, and how we manage this is really important. What I do just want to mention though is parvovirus is probably something that many of you have managed or tried to manage, and it's very tricky, right? There is an interesting publication out of Colorado State University that actually looks at a go-home protocol for owners that can't afford treatment, that can't afford hospitalization. And the researchers in this study actually looked at 2 groups of dogs, both had parvovirus. One group, they did intense hospitalization, IV fluids, IV antibiotics, intense nursing care. In the other group, they stabilized the patient and then sent them home. They sent them home with this protocol. Yep, so this is Convenia and Serenia. And they taught the owners how to do sub-Q fluids, how to do syringe feeding, and what they found was that the success rate was almost identical, 90% versus 80% in terms of the survival rates. And so there are ways that we can treat these patients that aren't necessarily gold standard, but they can offer very similar outcomes. Just one note on emaciation. A lot of times we see patients, right, and they're in terrible condition. They might have not eaten for a long time. They have, chronic illness. And when we see these patients that, we know have not had food in a long time, our first response is to feed it, right? Like we want to feed that animal and give it a lot of food and nutrients, but in fact, we have to be very careful when we do that, and we actually don't want to just, give free feeding. There's a syndrome called refeeding syndrome, that if you start to introduce food right away to patients that have been starving, you see severe metabolic derangements. And so we just have to be very careful. There are formulas to calculate, but essentially you just want to start eating very small amounts. And that's it. I'm going to skip the couple slides, so I think that wraps it up.
那请问一下，就是因为他在上一堂课一开始提到说，他的组织里面有照顾犬猫动物的，也有在关心野生动物的。那因为流浪狗社群的议题跟生态议题其实很常是在对立的冲突面，所以比方就像昨天在寿山的那个状况，其实猕猴跟流浪狗其实蛮容易有一些不同的想法，对于要不要把狗放回那个地点。那不知道他的团体遇到这一类的讨论或冲突的时候，他有什么想法？
Yeah, this is a great question because this is very pertinent, our organization, because we do have a wild animals department and we have, a stray dog department, which is essentially what I run. And so there's always this ongoing issue between wildlife and free roaming animals. And particularly in North America, it's almost impossible to be both a bird lover and a cat lover. Like for some reason, you have to choose one or the other. Like there's no middle ground. But what I would argue is that we all want the same thing. Like we all want humane reduction of the dog population or the cat population. Like nobody in this room is saying, yes, we need more stray dogs, right? And wildlife people are like, we don't want stray dogs and cats, right? So fundamentally, we all want the same thing, just different ways of going about doing it. And so we have to find what the literature and what the evidence says works, yeah? So we know that culling, that poisoning, that sheltering, that mass removal, that just doesn't work. And we have that very well documented in the literature, particularly with cats. We have a lot of evidence to say that just doesn't work. Low-level culling actually leads to more animals in a lot of this study because you end up taking out the bold animals, yeah. And so what I would say is when we have programs that we have situations where we have wild animals, we have companion animals, we have to find the solution that has the best probability of having success. We have a program actually in Borneo, and I'm not sure if this is why you're asking, because it's funny, we have this exact situation in Borneo where we have an orangutan academy. And the orangutan academy is for baby orangutans that have their mothers killed. And so what we do is we try to rehabilitate them and release them in Kalimantan in Borneo. Sorry, are you getting all this or do you want me to stop? Okay. And so we have this program, but the problem is that there's many free roaming dogs and cats in this area. And we worry about rabies transmission to the orangutans. We worry about bites, they get in conflict. And so we run a very comprehensive spay-neuter program in Borneo. It's actually the one program I didn't talk about in this presentation. And so we have a veterinary team in Borneo that also works with the orangutans, but their job, 80% of the time is to do mass spay-neuter, because we know that that's what has the best chance of having an effect, yeah, to protect, the welfare and of the orangutans is to minimize the disease and minimize the population. And if we do targeted sterilization, we can humanely reduce the population over time. That is fundamentally the best tool that we have in our toolkit. If we go out and we remove all the dogs and cats, the dogs and cats are there because there's an ecologic niche for them. And so dogs and cats will immigrate. So what I would just say to that, kind of the long-winded answer, is that in those situations, we need to look at our toolkit of options and pick the one that has the best chance of success to help protect both of these species. And in many cases, that is through mass sterilization, vaccination, medical care, and just surveillance and figuring out how we minimize conflict between wildlife and domestic animals.
好，我想因为刚刚上一场我们其实也没有 Q&A 到哈，所以刚刚主办单位说我们再开放多一点点时间，所以我们预计可以到1点25分，现在是1点17分，所以我们应该还可以再 take a few questions。好，那位。
不好意思，我想请问一下，就是
我也是问那个上一堂课的问题，那就是像在东南亚的那些计划里面啊，那假如他做的地方是比较首都、比较城市的地方，那会不会遭遇到地方团体的抗议啊？或者是说，其实刚刚有讲到，就是说，其实像那些比较都市的地方，可能其实也有地方的动物医院。那地方的动物医院是怎么去看待这样子的大规模的结扎？那在东南亚那样子进行的那么多的活动的过程中，有没有遭过到一些阻力这样子？
So our programs in Southeast Asia are working with local charities. So the reason that we choose certain locations are normally because that's where the local charities are. Yeah, and so oftentimes that's in capital cities. So it's just by nature. The program itself, the partnership program in Southeast Asia, is designed to, yes, to offer local programs for animals, but it's also meant to capacity build the local charities. Yeah, because the local charities, usually, they're not set up to do these type of programs. Like they're struggling to feed the dogs in their care. They're not thinking about sterilizing 30,000, 50,000. Like they're worried about keeping the electric on, usually. And so that's really where I see our role as an international charity to come in and try to work with them. I mean, we provide funding, right? We provide them with grants and we provide them with technical support and training. And a big part of this is training the local vets. In most of the communities in Southeast Asia, they've never heard of this. Like they've never heard of high volume spay neuter. It's very foreign. There is inherent resistance. So I'll say the local vets that we work with as part of the program that we're paying to do the service, they're excited. Like they want to learn new skills. They've never seen this. They really love being part of the program. Do we get issues with other community vets? Not so much because like the animal suffering is so high. Like I think that's one thing that really sets it apart. Like the stray animal suffering in Southeast Asia is so high. Like there's certainly enough work for everyone. Is there maybe some envy and some jealousy, I think, among local vets, and then they see, okay, this vet that they went to school with now is like on international websites and doing all this training. Is there some element of jealousy? Yes. But I think there's usually the local veterinary community is pretty accepting of these type of programs. Yeah, it's very new. So one more thing with the local groups too. The local charities are often working reactively. Like they're seeing animal suffering, they're seeing dogs hit by cars, and they're just running from one emergency to another, like trying to put out fires. I'm not gonna say they don't have the expertise, but they don't often have the time to step back and think, okay, well, how do we address like human behavior? How do we address the underlying issues here? Like, why are these animals suffering, right? Because they're so busy, right? So sometimes I think our role as an international charity in building these programs is to get them thinking more about addressing the underlying issue, which is usually humans. Like it's usually a human issue. And so trying to develop comprehensive programs and also involving veterinarians and training as well.
我请有3个问题请教一下。第一个问题就是有关于大规模的马拉松绝育活动这部分。那我不知道说这个活动它可以持续几天，那大概有基础兽医师能够现场支援。第三就是说就是现场能够结扎几只狗、犬、猫，这第一个问题。第二就是说，它有些流浪狗，它在结扎以后它回治，我看到它有那种刺青的方式，我不知道刺青方式的效果怎么样，它在狗身上或出猫身能够持续多久的时间？ 然后第三个问题就是说，有关于说在结扎的手术当中，或是手术之后，有发生犬猫的异常，甚至发生死亡的时候，我不知道你们我们兽医师怎么去安慰饲主，或者说怎么去处理后续的方式。
Okay, well, yeah, that's many questions, and I would say every clinic is different inherently, so it's kind of hard to say. Some of our clinics have 1 veterinarian, some of our clinics have 2. The Spayathon for Puerto Rico had 12 cutting at one time, and so oftentimes it's not so much about the number of veterinarians, it's about the number of support staff. And so you need to have adequate nurses and people doing recovery, anesthesia, all of that, right? The prep. So I normally say a good ratio is 1 veterinarian and 3 nurses. That will make sure that there are always animals on the table and that there's a veterinarian, that there's people monitoring the patients adequately. So that's a general, like, rule of thumb. With our Bangkok program, we have 2 veterinarians, 3 nurses, and a manager. So that's working the nurses really hard to do 50 animals a day. But that's kind of the clinic makeup that we have. But like in Spayathon for Puerto Rico, again, we have 12 surgical tables going. And so we have dozens of nurses that fly in. I mean, there's probably 35 nurses that are running around. So it just depends on the clinic. And similar with anesthesia, every anesthetic protocol is different. In Spayathon for Puerto Rico, we have 5 clinics running simultaneously, and each one has their own anesthetic protocol that we have made sure is okay. Yeah, we want to be sure. But animals anesthetically, they're waking up, within an hour, usually. They should be at least raising their head, and they should be up and walking 2-3 hours after surgery. So all of the patients that came into the Spayathon clinics, they're walking out the door with their owners at the end of the day. So the owners with their animals are in the clinic 4 to 5 hours. From the time they go there, the animal has surgery, it recovers, they're walking out 4 to 5 hours. Because it's efficient and it's quick. There was a question I'll just mention. He had asked about how you console when patients die. And I did just want to mention, I mean, every pet owner signs a waiver, when they come to the clinic, that they recognize, that there is an anesthetic risk. I mean, again, I would argue that our mortality statistics are better than most veterinary clinics. I think particularly in Vietnam, we run a small clinic to do this type of work, spay-neuter work. And there's 0 veterinary capacity in all of central Vietnam. And so there is a clinic that sees cats and dogs that quotes patients a 50% chance of their animal dying from surgery. It's like, that's the level of care. And so if we can help elevate that level and train local veterinarians and show that there are better ways of doing things, then that's great. Oh yeah, tattoo. Yeah, tattoo for life. I mean, ideally, yeah. It does fade. I mean, that's one of the things. If we don't press it in hard enough, particularly in the ear, it might fade. But the tattoo is for life.
好，那我想非常谢谢 Katherine。我想 we have to wrap up here. Okay. Thank you so much. Thank you. 非常谢谢 Katherine。